My heart rate was spiking into the 200s. Got to a point where even taking the trash out, my heart rate would go up to 170 on my Apple Watch.
As a med school student, she knew all the signs of this particular autoimmune disease, yet still she wrote it off as stress. Coming up on today's All Things Heart, the risk to your heart if you have this fairly common disease and don't get treatment.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, December 8th. I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today. It's safe to say a fourth-year med school student could be a little bit stressed out. However, her symptoms weren't stress at all. It would turn out she had an autoimmune disease. If untreated, this disease could have caused heart problems. Plus, heart stopping national recognition, or we should say heart starting, where you can see one of our doctors featured in a national publication for his life-saving skills, and why our doctors are reaching new milestones with a new record here at the University of Kansas Health System. As always, we love connecting with you, so please send in your questions. You can reach us right now on YouTube, Facebook, and through the All Things Heart email. You can find all those links right here on your screen. Today, we're learning more about Graves' disease. It's the most common form of hyperthyroidism. The autoimmune disease affects nearly 1 out of 100 Americans. It's rarely life-threatening if you get it treated. But without treatment, it can lead to serious heart complications.
Ever since she was a little girl growing up in Overland Park, Amber Smith knew her future was in medicine.
When I was a kid, my parents actually gave me a science kit. And so when I was younger, I would run around the house and grab my parents and my parents' friends for their experiments.
A fourth-year med student at the University of Kansas School of Medicine, Amber says one of her best learning experiences came from something unexpected: becoming a patient.
I think it really taught me about great communication with patients.
Her symptoms began in fall of 2021.
It was like 2 a.m. I couldn't sleep. My heart rate was just out of control.
But for weeks, Amber says she wrote off the racing heart and palpitations as stress.
I was getting them every single day, like 4 to 10 a day. And then I was noticing when I was working out that my heart rate was spiking into the 200s. Got to a point where even taking the trash out, my heart rate would go up to 170 on my Apple Watch. It's funny because as a medical student, everyone jokes like, what'd you diagnose yourself with today? And I definitely, something was actually going wrong. I just kind of minimized it. I was like, oh, I'm stressed.
Finally, a trip to the ER led to an appointment with an endocrinologist at the University of Kansas Health System who diagnosed Amber with a treatable autoimmune disease affecting her thyroid called Graves' disease. But untreated, it could lead to many complications, including heart failure.
We are so happy Amber is joining us this morning, along with her endocrinologist, Dr. Lee Ack, and cardiologist, Dr. Brian Wyford. And full disclosure, Dr. Ack, you're my endocrinologist as well, because Amber and I have something in common. I was diagnosed with Amber's autoimmune disease as well. So I want to start with you, Amber. You say when you were studying for your med school test on Graves' disease, you saw the exact symptoms that you had listed, but you didn't make the connection because you were stressed out.
Yeah, it was funny. I was studying for my end of rotation exam in internal medicine where there are a lot of autoimmune diseases on the test, and I would do questions in the back of my mind. I would think, is this what I'm going through? But I was like, no, I'm just stressed.
Because you were sick of diagnosing yourself probably with everything that you were studying.
Exactly.
So you pushed off the one thing you had. Do you have a family history of Graves' disease?
I do have a family history of thyroid disease. It's a little uncertain whether it's Graves' disease, so potentially.
So, Dr. Eck, who's most at risk for developing Graves' disease?
So there certainly is a genetic predisposition to Graves' disease. Women are more likely to develop Graves' disease than men.
Right.
Smokers are more likely to develop Graves' disease as well. Individuals on medications that contain large amounts of iodine are also at increased risk of developing Graves' disease.
Graves' disease runs in my family. Now, no one was a smoker that had it, but I could name 5 women on my mom's side of the family that all had it. I want to bring in our cardiologist, Dr. Wyford. What is it about the untreated, uncontrolled Graves' disease that impacts your heart? What's happening?
Well, because the thyroid gland acts as the storehouse of energy for the body, it's kind of like the heart is having to work extra hard because the thyroid gland is kicking out more hormone than the body needs. So the heart is then sensitized to have to work harder, beat faster, beat more forcefully, and our hearts just aren't made to do that.
So your heart's just constantly fluttering.
It's having to work extra hard,
yeah.
Typically beating faster because it's under a greater demand.
So what are the treatment options, Dr. Eck?
So patients that present with Graves' disease, we often start them on an antithyroid medication called methimazole to quiet things down. Long term, we can continue that antithyroid medication, or we can treat with radioiodine to kill off the thyroid gland to render it unable to produce thyroid hormone. Or occasionally, when we need to urgently solve the problem, we could resect the thyroid gland with a surgery called a thyroidectomy.
So just take it out?
Just take it out.
Do you take out part of it or the whole thing?
We would take out the whole gland in the setting of Graves' disease if we needed to urgently manage that situation.
We're going to put up a QR code on the screen for our viewers because we want to make sure you know where to find information on thyroid disease and how to connect with our endocrinology department. So that QR code is up on your screen. It will take you to all of our resources. I want to bring Amber back in. Amber, what treatment did you go with?
Yeah, so with the guidance of Dr. Eck, I was started on methimazole as well as propranolol for heart symptoms, and I haven't had to take the propranolol since June, so just methimazole now.
That's exactly what I did. Methimazole, is that how you pronounce it?
That's exactly right.
I've been pronouncing it wrong now for 20 years. Methimazole. Propranolol, that helped, and then once it gets under control, you don't have to take it. So, Dr. Wyford, do you commonly see patients with Graves' disease come to you?
It's not uncommon. Fortunately, it's not a really high frequency of patients with Graves' disease or hyperthyroidism that have heart complications, but because it's not an uncommon problem, we do see that. And oftentimes it's people having a sense of their heart beating fast or racing, like what Amber was experiencing. And the water can get pretty muddy as far as why is that happening? Is that stress? Is that other things in our lives? And just like in Amber's case, the diagnosis can sometimes be delayed because it overlaps with a lot of other things.
I want to talk about the symptoms because Amber, the symptoms can mimic anxiety. That's what Amber had. But what are the other symptoms? Because Dr. Eck, when I had thyroid disease, Graves' disease, they think I had it probably for 2.5 years before I finally saw a doctor or even thought to mention it to my GP. What signs should we be looking for as women who might have this in our family, and men too?
So the classic symptoms of thyroid disease or an overactive thyroid gland are feeling hot when others are comfortable, feeling like your heart's racing, feeling shaky, a little tremulous, having more stooling pattern that's increased in frequency, weight loss despite eating the same amount of food or more food, insomnia, trouble sleeping, and certainly anxiety. We see worsening anxiety in patients with Graves' disease that's unmanaged.
Is it anxiety, or is it that your heart's pounding so that makes you feel anxious because your heart's pounding?
I think you're all revved up, so that
like
just drives everything.
A dog chasing its tail.
That's exactly right.
We're getting some really good community questions from viewers, and some of you have been emailing us. Jesse wants to know, how do you test for Graves' disease?
So if somebody presents with symptoms to suggest hyperthyroidism, we're going to start by obtaining thyroid function studies. So we'll obtain a TSH, a free T4, and a total T3 in that circumstance. If it's consistent with hyperthyroidism or too much thyroid hormone production, then we'll either proceed with what's called a radioactive iodine uptake and scan, which can help solve many causes of excessive thyroid hormone production in terms of an answer. or we'll obtain antibodies that are specific for Graves' disease if we think that that is the likely diagnosis. We might think that in somebody that has an enlarged thyroid gland with eye involvement. So if they have something to suggest Graves' eye involvement, then we might just go ahead and get those antibodies and not need to do the uptake and scan.
What do you mean by eye involvement?
So there's something called thyroid eye disease that presents
when the eyes bulge out. That happened to my aunt.
Yes.
Okay.
So that can be seen in up to 25% of patients with Graves' disease. So those stimulating antibodies that drive the thyroid hormone, the thyroid gland to make too much thyroid hormone, can also increase swelling and inflammation in the muscles around the eye, as well as the soft tissues around the eyes, and cause what we call a bulging of the eyes, or apoptosis.
Carl has a question for Dr. Wyford. Carl wants to know, am I at a greater risk for a heart attack because I have Graves'?
So there can be, and I think that's particularly seen in older individuals that have hyperthyroidism or Graves' disease. But the majority of people with Graves' disease, the risk for heart attack is not particularly high. But rhythm problems where our heart is racing either in our normal rhythm or an abnormal rhythm like atrial fibrillation would be a much more likely scenario.
Marie has a question for Dr. Eck. She wants to know, is it better to have your thyroid removed, take the pills, to zap it, or take methimazole? By zap it, does she mean that?
She means the radioactive iodine treatment. So generally, as I mentioned, when somebody is really hyperthyroid, we're going to start methimazole and get things quieted down. From there, we can make a decision with our patient that fits best with their goals and needs. So if somebody has evidence of thyroid eye disease, we're less likely to use radioactive iodine in that circumstance, because radioactive iodine is thought to potentially worsen or cause Graves' eye disease. So
and is that a pill you take, the radioactive iodine?
It is, yeah. It's in our nuclear medicine department here at KU, and you come in and take a pill, and the iodine is taken up by the thyroid cells, and so we are able to deliver a radioactive treatment specific to thyroid cells.
I remember 20 years ago, when I was first diagnosed, they offered me that pill, but said I couldn't hold. This is at a different hospital, different part of the country, but you can't hold any babies for a few days. Is that still a thing?
We certainly don't.
That freaked me out a little bit, but what's the deal with that?
So the dose that we use when we're treating patients with Graves' disease is very, very small. So when we treat patients with radioactive iodine for thyroid cancer, we do ask them to be away from kiddos, other individuals for 5 to 7 days.
Okay.
The limitations after Graves' treatment are really short in duration.
We have a question from John. John wants to know, for Amber, how soon after you started taking the medicine did you feel normal again?
Oh, that's a great question. I think I first started noticing differences about a month or so in to treatment, and I don't think I felt fully back to normal until around June, July, so it took a little bit of time.
Joan has a question for Dr. Eck. Joan writes, I have Graves' disease and my boyfriend smokes around me. Could that make my eyes bulge?
So smoking does increase our risk of thyroid eye disease. So we certainly advise our individuals that have Graves' disease to avoid tobacco products, smoking themselves, as well as secondhand smoke exposure.
Would it have to be a lot of smoke exposure, or could someone just taking a puff of a cigarette near you make that happen?
You know, I think avoidance is always the best answer, so that would be advised.
Lauren has a question. She wants to know if you can fix it if that happens. Is there any way to correct that?
So our ophthalmology colleagues help us to manage thyroid eye disease. There is a new medication on the market that helps with that. We do surgeries to help with reduction of the bulging in eyes in thyroid eye disease.
Lisa has a question. We're getting a lot of questions from our female viewers. Lisa has I have a family of thyroid disease, a family history of thyroid disease. My labs have been normal so far. How often should I be checking or get checked for thyroid issues?
So thinking about screening for thyroid disease, we should certainly obtain thyroid labs if a patient has symptoms of hypothyroidism or hyperthyroidism. We're going to be more sensitive to ask questions about those symptoms in the setting of a family history of thyroid disease. If a patient is asymptomatic, we generally don't obtain labs just to screen for it, and instead we'd rescreen for symptoms at an annual physical examination.
Couple questions coming in for Dr. Wyford. Jean Schlotzauer says, would like me to ask you, can hypothyroidism have the opposite effect, a slower heartbeat? So we're talking, Graves is hypo, what would that be called?
Hypothyroidism.
Just hypo, okay. And then would it have the opposite effect on your heart?
It can. So whereas hyper, the heart is revved up, hypo,
right,
it's sort of slowed down, and sometimes it can slow the heart rate significantly. Both conditions can make the heart malfunction electrically, but also mechanically. So whereas in Graves' disease or hyperthyroidism, the heart can sometimes fail because it's overworked.
Mm-hmm.
In hypothyroidism, it can sometimes fail because doesn't have enough energy to contract and function like it should.
We were talking about the propranolol. That's the name of the pills that Amber took that could slow down your heart right away. What would be the equivalent of that if you had hypothyroid?
Well, I should let the endocrinologist answer that.
Yeah. So in the setting of hypothyroidism, we're going to start levothyroxine therapy.
Okay.
There wouldn't be a cardiac medicine except in an emergency that we would initiate in the setting of hypothyroidism. Instead, we'd initiate thyroid replacement medication with levothyroxine, which is T4, the hormone that our thyroid gland produces.
So another pill, but different, totally
Another
different.
pill, but totally different, yes.
John has a question for Dr. Wyford. He wants to know, how do you treat for heart complications from Graves?
So the rhythm complications are the most common thing that we'd experience, and usually the most important thing is to get the Graves' disease and the hyperthyroid state treated. Propranolol, as you mentioned, is a beta blocker that's focused on trying to slow down the heart rate, sort of because it's so revved up, we want to gear it down and get the heart rate back into a more manageable level. So like what Amber was experiencing, that her heart was racing even when she wasn't doing anything that should cause that. So a beta blocker is a good way to try to help that. If the heart's out of rhythm, in a rhythm like atrial fibrillation, what we'd usually try to do is, once the thyroid gland has been normalized, once the levels are back to usual, we would hope to see that the rhythm is back to normal. If it's not, we can sometimes do things to try to reboot the heart back into a normal rhythm, like a cardioversion.
Want to ask Amber this question. Amber, Angie wants to know if you had any other symptoms besides the pounding heart. Did you have sudden weight loss or any other issues, or was it just the heart pounding?
Yeah, I had a lot of the typical symptoms. I think once all was said and done, I lost around 10 to 15 pounds. I was anxious. I had these episodes of becoming incredibly hot all over my body and sweating. And then I would also have these daily headaches when I was even the slightest bit dehydrated. So I had to drink around 3 to 4 liters a day to prevent that from happening.
Wow.
So I had a lot of them.
Is there permanent damage, Dr. Wyford, to the heart, or once you're treated, does it all go back to normal?
Usually we would see the heart go back to normal or near normal, but I think where it gets tough is this isn't occurring in isolation, because especially as people get older and they have more medical problems, there's other factors that also influence our heart health. But by and large, I think if it's treated appropriately and early on enough, that we usually see the heart function return to normal.
Question from Carrie, and it's about Amber, but it's for Dr. Eck. Will Amber have to be on medication for the rest of her life, on and off, the methimazole?
Methimazole. So that's to be determined. In patients that receive methimazole treatment for 1 to 2 years, we can see a remission in up to 40% of those patients. If you're on methimazole for 5 to 10 years, the remission rate can be as high as 85%. Amber could elect to proceed with radioactive iodine treatment to kill off her thyroid gland. That would cause her to be hypothyroid, and she'd be on then the replacement hormone levothyroxine.
For the rest of her life?
For the rest of her life.
So, or she could get it removed with the surgery.
Yes, and then we would be on levothyroxine in that situation.
Is there any downside to levothyroxine, like a danger or a side effect or anything, or it's just?
No, it's pretty straightforward. We calculate a weight-based dose, and then we assess thyroid function testing to make sure that we're on the adequate dose. Amber is young, so we want to be cautious about thyroid disease and pregnancy.
Right.
So we would make sure that Amber was aware that I needed to be engaged in her care prior to pregnancy and throughout pregnancy, whether she was still on the methimazole for treatment of Graves' disease, or if she had received radioactive iodine treatment and we're managing hypothyroidism. We want to be very thoughtful about managing thyroid levels in pregnancy.
Angela has a great question. She wants to know if there's any danger years later from taking the radioactive pill, because her mom took the pill 35 years ago.
That's a good question, and that's something that patients pause about when making a decision about whether to proceed with radioactive iodine treatment or not. There's limited data that there may be a slight increased risk of malignancy, cancer, in patients that have received radioactive iodine, but it is such negligible data that it's hard to say if it's cause and effect.
Okay, and then Angela has another question for you. I love that our viewers have this direct access to our doctors. This would be something that if everyone had this. It's such a great service. You just type it in and you get an answer right away. Amber wants to know what's the difference between menopause hot flashes and thyroid hot flashes. Rather, Angela does, because her mom had thyroid disease. Now she's getting hot flashes. So is she in menopause, or does she need to come see you?
So I think labs would help us to answer that question. I think, anytime we have symptoms that are outside the norm, we should visit with our doctor and think through what could be the cause of those symptoms. And oftentimes, as a physician, we're leaning on our laboratory to help us answer those questions for our patients.
I do have a question for Amber. Amber, so you're in 4th year of med school now?
Yes.
Do you know what you want to specialize in or what you're leaning towards?
Yeah, so right now I'm applying into the field of internal medicine. After that, I'm not too sure what I want to do, so we'll see.
I want to actually then now start with you for our final thoughts from our guests, because when we were doing our interview with you, as a med school student, you talked about how you learned so much from being on the patient side, and it's stuff that you really couldn't learn in any kind of a class. What did you learn?
Yeah, I think my experience as being a patient will definitely help to inform the care I give when I'm a practicing physician pretty here soon. And I think what it really did was emphasize the importance of communication. Here I am, somebody when I was diagnosed who was studying the disease, who knew the treatment options, who knew the next steps, but even then I still felt a little lost in the sauce of how to navigate the system. And so what I really appreciated about Dr. Eck's office is that whenever there's a medication change or a new lab result, I get direct contact from them. And it really empowered me as a patient. And so I want to make sure that I do that for my patients as well, making sure they understand their disease process, making sure they understand the options, and then we can create a plan together. So I think I learned an invaluable lesson through all this.
Aw. Dr. Eck, that's so nice. That must make you feel so good.
I tell you what, caring for Amber was really a fantastic opportunity for me. I think this is why we do this work, is because we want to serve our patients. And Amber was such a fantastic story. She was feeling very poorly, and we could help her to get to a better state of health very quickly. And I'm so glad that she's there, and also glad that she's going into internal medicine.
Yeah.
Dr. Wyford and I are both internists, so that's exciting.
That's great. And you are a very good communicator.
Oh, thank you.
I can vouch for that.
Thank you.
As one of your patients.
Thank you.
Dr. Wyford, as a cardiologist and being on this panel, what would be your message to people watching?
Well, this is a great example of how different organs of the body, different parts of the body interact with each other. And so I think more than anything, listen to our bodies. If it's telling us something's wrong, we should heed it and talk to our physicians, and get to the root of what's going on.
We are coming to the next segment that I just love in this program. It's called Behind the Mask. It's where we get to give you a peek at what our healthcare workers are like on a personal level. So let's get to know Dr. Wyford a little bit better. Dr. Wyford, you say if you could be anywhere in the world outside of the hospital, it would be the mountains. So we have this awesome picture of you and your wife here with this gorgeous backdrop. Where are you?
Jennifer and I were at Mount Rainier.
That's so pretty out there.
We did not climb Mount Rainier, but we hiked around it, and that was fantastic.
We have some more pictures that you shared with us. We have some other pictures of you with your family, so tell us who's in the picture here with you.
So I think last time I was on here, I shared pictures of our dogs and not my family, so I better show some love to them. Yeah. So my son Jack on the left, my wife Jennifer, and my daughter Maddie, and then my son Connor.
Good-looking family. And where was this one? Where was this one taken?
So that is in Northern Ireland.
Oh wow! So you're a traveler.
Well, we've gotten COVID kind of put the pause on everybody's travel for a while, but we're trying to get back into it a little bit.
Now you've got that vacation itch that you got to scratch.
Yes.
Dr. Eck, I want to get to you now because you have recently accomplished something very cool. Take a look at this. Here she is. Okay, who's your cheer section there?
So the gentleman yelling is my husband, Steve, who was taping this.
And this was the New York City Marathon?
It was the New York City Marathon in 2019, right before COVID. So we're really fortunate that didn't get disrupted by COVID.
Was that your first marathon?
It was my second marathon. I did run a marathon during residency, actually.
And how'd you do?
Well, we finished, and I had a goal of finishing under 4 hours, and I achieved that only because I was running with a very experienced marathoner, and she carried me over the finish line.
Yeah, but your legs had to do it.
Well, that's right, but the psychology of it was definitely Dr. Cooper, who ran with me.
Oh, cool. So how long do you train for your marathons? Or are you just a constant daily runner and then you ramp it up before?
I run frequently, but not those distances. So in 2019, it was my neighbor, Susan Leonard, and I who started training in February, and the marathon is in November. So it's quite a long track to get ready for a marathon.
I get tired and overwhelmed watching the end.
It was such a fun day.
How are they still moving?
Yeah,
you shared some more pictures with us that I want to get to because you love traveling as well with your daughters, and I just love these pictures. Where are these taken?
So that was this summer, and my husband was with us as well. He was the photographer. We were in Lisbon.
Nice.
And it was fantastic, yes.
And where's your favorite? Oh, this one I love because you look like you should be on an indie album cover.
Well, I did have my children in a bar, which that may not have been the best choice.
They weren't babies, though. You weren't holding a baby in a bar.
No. So we were in New York City, and we were going to a comedy club that was in the backside of this bar. And again, my husband was taking the picture, so I feel bad that I didn't include him, but
he's the historian.
Maybe
we'll get him
next time.
We'll get him next time.
Maybe next time.
Well, any upcoming trips?
Actually, we're going to New York City again at Christmas to go to a Broadway show.
Take more pictures.
Yes.
More pictures. We will show your dog again, Dr. Wyford.
Sounds good.
We don't want to leave anyone in the family. We need to see your husband. We'll get proof of life.
And we have a dog.
And a dog. Okay.
Yes.
Well, we'll have.
He's the favorite member of the family.
We gotta have the dog on next time.
For sure.
We have some more exciting things to share with you. We have 2 stories to share with you. First of all, our very own cardiothoracic surgeon, Dr. Matthew Danter, was featured in the New York Times. He was performing a coronary bypass in these pictures. That's where he temporarily stops a patient's heart and redirects blood flow around a blocked artery, and then he restarts the heart. We are so proud of Dr. Danter and the work of our amazing medical teams here at the health system. Love you all. And speaking of incredible medical teams, we just tied a record with ourselves. It's a pretty cool thing to do. For the most heart transplants performed in a single month. In November, we had 7 heart transplants. The last time we did that was November of 2021. And back in September, we had 6 heart transplants just in the month of September. Typically, we do 1 to 3. So we had 6 and then 7. That is pretty cool. So congratulations to all of our health teams. And thank you so much to our incredible doctors, Dr. Wyford and Dr. Eck. Thanks for taking your time to join us today. And I also want to thank Amber, our wonderful patient and med school student, for sharing her journey with us. You're going to be a great doctor, we can just tell. And thank you all for watching. Coming up next week on All Things Heart.
Dr. Poli early on described me as a stroke waiting to happen.
A stroke waiting to happen. That is not what you want to hear for your doctor's visit. What this Kansas City woman did next, though, and how her doctors helped her is nothing short of incredible. We'll see you next Thursday morning at 10 a.m.